COVID-19 punctured an already bleeding system.
We know improvement in your health comes by treating the underlying condition. So our country needs to treat our underlying condition.
The pandemic fully diagnosed the nation's racial health disparities. CDC data from mid-July shows when compared to white Americans, Native Americans were 3 times more likely to be hospitalized from COVID-19, Black and Hispanic Americans 2 times, and Asian Americans 1 time. The agency's data also shows people of color were almost twice as likely to die from the coronavirus.
Now there's this urgency.
Dr. Matrice Macon isn't shocked by these numbers and that they're reflected here in Indiana.
As a country, are we addressing healthcare delivery as a right, or are we practicing healthcare delivery as a privilege?
After 38 years, the retired Black anesthesiologist says the pandemic's shown us healthcare is often a privilege and not one afforded to all Hoosiers.
We have to address them.
Now she and 10 congregations are working with IU Health to address racism in healthcare and the disparities it causes.
And so if I've gone into an emergency room seeking care, I've been looked at as just a single Black woman who no one cares about a title at that point. And there are so many members of our congregation for whom that is the same reality.
Reverend Shonda Nicole Gladden organized these churches through Healthy Me Learning Community.
I've seen disparities.
Together, the group asked healthcare systems tough questions. Several times over 2 months, we reached out to the region's 3 major hospital systems. Despite repeatedly extending our interview window, IU Health and Community Health declined, but Ascension St. Vincent did answer our questions.
We do have a commitment to ending systemic racism and injustice.
To do that, the hospital system recently launched a program, Abide.
And this framework really helps us recognize what we need to do to review and rebuild our policies, practice ways of working, so that we can eliminate what perpetuates disparities and inequities.
An Abide statewide council will look into race and healthcare in this hospital system. Several community advocates applaud this type of action, but say more is needed. For some, that starts by looking at the past to better the future. The 2019 National Healthcare Quality and Disparities Report found in the last 2 decades, healthcare access has significantly improved. But in some cases, racial disparities remained or even got worse. One local pastor says addressing this today creates a healthier Indiana for all tomorrow.
The humanity of all of us sometimes gets lost in talks of healthcare and treatment and these things. And if we care about one another, that all of these things and that anyone is having inequity in any system, that we need to address those things and do our best to work together for a solution.
Reporting in Indianapolis, I'm Beairshelle Edmé.
And right now at Fox59.com, our web team has shared an interactive tool to break down what healthcare leaders are doing and have done to address those differences.
COVID kind of hit rural communities a little bit later than the urban areas last year, but once they hit those communities, they hit them hard.
Rural America making up about 15% of the nation, but these areas are outpacing metro areas for COVID deaths.
Yeah, the Delta variant has shown rural communities are at a high risk, and much of that is because of geographic disparities.
Fox 59's Beairshelle Edmé continuing her series finding out how this health disparity affects rural Hoosiers.
COVID-19 is killing rural Americans twice as much as their neighbors in urban areas. It's the latest data from Rural Policy Research Institute. Sadly, thousands of Hoosiers face the same rural health disparity. Purdue classifies 33 of Indiana counties as a rural mix and 41 as rural. A recent report found most of the state's hotspots are in these rural communities.
Many of these issues have existed for a long time in rural communities, and so these are systemic healthcare problems that need to be addressed. But they would have helped us to fight COVID if we had addressed them before.
Experts we talk with say at least 3 of these issues lead to Indiana's rural health disparities. One of them is a lack of healthcare staff, especially in primary care.
We've seen this in studies that if people have a relationship with a doctor they trust and have been able to talk to that doctor, they're much more likely to get vaccinated.
But the Indiana Rural Health Association found
access to a provider is a limitation. The only other area, or one of the other areas that an individual may look for information, is social media. And unfortunately, what we're seeing on a lot of our social media platforms is misinformation about the pandemic.
It's really unfortunate.
Dr. Emily Backer says misinformation is the biggest challenge in the pandemic.
I've had a lot of conversations as a primary care doctor with people who are not vaccinated and tried to explain the data to them, tried to explain the risks. And, for some people, it's just, a blank wall. There's no convincing them.
Dr. Backer works for the health department in Howard County. Regan Streif Institute considers Howard County one of 10 rural COVID hotspots with more hospitalizations per capita than urban areas. As of mid-October, the Indiana State Health Department reports nearly 50% of the eligible population there was fully vaccinated. It's 60% in nearby urban metros, Marion County, and 80% in Hamilton County, both larger than Howard. Like other communities dealing with high COVID numbers, Howard County faces a second geographic disparity.
Lack of access to the internet can be a barrier because we've seen with healthcare now, with COVID, there was a lot of telehealth activity, for example. Well, if you live in a rural community and you don't have broadband internet, you cannot connect to those providers remotely.
Without dependable internet for telehealth, many rural Hoosiers are forced to find an open healthcare provider, which requires a vehicle.
Transportation issues continue to grow in a negative trend, unfortunately.
It's a third rural health disparity.
You don't have transportation, then you're essentially cut off from the healthcare system.
Most rural Hoosiers won't find public transportation to travel for.
Things like testing, COVID testing facilities, COVID vaccine options, and so really the health disparities that we saw pre-pandemic were just simply exacerbated.
Lack of healthcare staff, internet access, and transportation all contribute to rural health disparities. But COVID-19 has doubled down on just how serious these issues are for rural Indiana's health. Reporting, I'm Beairshelle Edmé.
Now, Beairshelle also asked state health leaders how they plan to address these issues in rural Indiana. You can go to fox59.com right now to see the newest $250 million effort to bring internet access to these communities. Plus, you'll also find her previous report on racial health disparities as part of this series.
Well, for many Hoosiers, filling their prescriptions can be a roadblock to getting healthier. That's because many people in Indiana don't have a pharmacy in their neighborhood.
Fox 59's Beairshelle Edmé actually found Indianapolis communities struggling with this issue, especially during the pandemic.
Yeah, she has her final report now in her series on health disparities.
She explores the city's pharmacy desert and finds out what Indiana lawmakers plan to do about this.
When you don't feel well, doctors may prescribe medication to manage your health. A study this May found 60% of Indianapolis neighborhoods are in a pharmacy desert, which is well above the national average, more than 30%. That means there's no pharmacy within a mile of these neighborhoods, like on the near northwest side.
The other drugstore, they closed it down at 38th and Illinois, CVS. They've been closing and reopening drugstores for the last 10 to 15 years.
So do you think it's easy to get to a pharmacy in this neighborhood?
No.
Why not?
Well, they moved away. You gotta go 5 to 10 miles out of the way to get something.
Been over here 42 years on the west side, and I've never seen a CVS or a Walgreens or no type of pharmacy.
So where do these Hoosiers go? For veteran Wendell Crenshaw, the VA mails him his medication. Otherwise, we mapped it out, and his closest pharmacy is about 2 to 3 miles away.
Adherence to medications has been a persistent problem.
Dr. Dima Cato, who coined the term pharmacy desert, explained to me the pandemic further impacted this health disparity.
I think during the early part of the pandemic with the testing, it became really apparent that, where do we go to get tested if the pharmacies are so far away?
The Raphael Health Center on the near north side knows the answer to this. It's in a pharmacy desert where many patients take the bus. We took the trip, and the easiest pharmacy to get to is either 3 or 6 miles away.
There was a wait at CVS and Walgreens. They were doing a great job, but they had waits. So then you can't wait because you've got to pick up your child or go to your job so you don't get tested. So that means you are incubating potentially or spreading. It's really bad.
I requested testing and vaccine data for 3 Indy neighborhoods considered pharmacy deserts. In all 3, less than 25% of the population had gotten a COVID test at some point. Nearly half of Marion County is fully vaccinated. Both Mapleton Creek and Crown Hill fell below that average at 44 and 32%. The Watson-McCord neighborhood was just above that average at 54%.
I think that healthcare delayed is healthcare denied. And so people aren't vaccinated because it's just hard to get there, to get the information you need.
In 2018, a bipartisan measure to study pharmacy deserts passed. 3 years later, I tried to track down what your elected officials discovered and proposed.
We did have an opportunity.
There was nothing because the study simply never went forward.
And over the next 3 to 4 years,
I asked a co-sponsor, State Senator Eddie Melton, why.
If it was assigned to a committee, sometimes the chair has the discretion on whether or not they're going to go forth with moving forward.
After our questions, Mr. Melton told me he plans to file some sort of legislation to readdress this statewide issue. That includes bringing pharmacy execs to the table.
I think we have to look at that model because many of them may generate their revenue more, not on the store amenities such as food and other services, but they're looking at how many folks are filling scripts. That's why having a study is critical.
And critical is exactly how residents describe the situation in their neighborhoods, now turned pharmacy deserts. Reporting in Indianapolis, I'm Beairshelle Edmé.
Fox 59 actually reached out to several major pharmacy chains to ask about their departures from Indy neighborhoods and if they will reinvest in our communities. You'll find that answer on fox59.com. That's also where you can use this interactive tool to learn if your neighborhood is a pharmacy desert as well.